is the Global Health Fellows Program, and what is it like to be a Global Health Fellow? I'm Sharon Rudy, Program Director, and I get asked these questions a lot. First, there is our commitment to help create a new generation of global health professionals through the fellowships and internships that we implement for the United States Agency for International Development, and the importance we place on striving to develop a diverse and inclusive workforce. A workforce made up of more than 100 technical experts at all levels, based in Washington, D.C. and overseas in places like Sub-Saharan Africa and Southeast Asia. Then there is our professional and organizational development work, retreats, workshops, specialized coaching, all meant to support performance and professional growth. But ultimately, the Global Health Fellows Program is about people doing vital, interesting, meaningful work. Experience their commitment and enthusiasm and see how their stories might help to clarify your own goals for the future.
What a memory book is when a parent knows that they have a life-threatening disease, such as HIV, in this case they did, they put together a book of different memories for their children. And then the child has that book forever. I met this little girl in Uganda. Well, I say little. She was very petite, but she was actually about 14 years old, and she was very soft-spoken, and so I thought she was initially younger. And she showed me her memory book. And in her memory book, there were pictures of her parents' funerals. And I thought, oh my gosh, this is, I don't know if I could take this out and open it and if I were in her shoes. And, before I really thought about it, which in retrospect, I probably shouldn't have said this, but I looked at her and I said, this doesn't make you sad to look at this? I mean, because it was, it was a funeral. But the book has a lot of other things in it. And she looked at me and she goes, oh no, it makes me less scared because I know my parents loved me and they made this for me. And I think of them, and when I think of them, I'm less scared. And I just thought that was really, really wonderful. The resilience that kids have, and that's something that we really try and work on, is kids have a lot of strengths and families have a lot of strengths. And I don't care how poor the community or hard hit it is that you go into, there is a lot that community and those children and those people have. And a lot of what we do is help bringing in those things that they don't have there, like drugs. They're not going to make their own drugs.
Seeing the people who have benefited directly from the programs, whether it's people who you're pretty sure have not been infected with HIV because of effective HIV prevention programs, or seeing people who are very much alive and healthy because of the interventions that the U.S. government is implementing in Vietnam. And one of the stories that I always like to tell is about a young woman who works as an administrative assistant in a clinic that USAID supports through Family Health International in Ho Chi Minh City. And the fact was that she was infected with HIV through her husband, who was an injecting drug user. And her husband died, and shortly after that, she found out that she was HIV positive. And her family and her friends took her around to many different hospitals to try and see if they could find ARV drugs to treat her. And ultimately, they weren't able to find appropriate services that were available for her until they came to the clinic that was supported through the U.S. government, and they were able to put her on a course of treatment. And when she arrived at the clinic, she weighed about 40 pounds, and everyone presumed that she would be dead very soon. But to look at her today, you would just never even realize that she was living with HIV, much less that she had almost died from HIV disease. And so it's it's success stories like that I think really make it worthwhile.
Recently, I spent 2 weeks in South Africa, and we visited a few projects that were there. And one of the projects was in a township, and we were looking to see what the project was doing and the kind of work that they were involved in. And one of the nights we went out to a local bar in the township and just saw what was happening there, because a lot of HIV prevention work revolves or should revolve or have something to do with alcohol. When people are at bars, that's where a lot of prevention work can happen, and just trying to understand the dynamics there of sexual partnerships and the cultural context and the social context, and having an idea of what really is happening and how we can actually get programs to that level and make sure that they're effective at that level.